So Behavioural Supports Ontario is an initiative funded by the Ministry of Health and Long-Term Care in 2010 to enhance care and services for older adults with dementia, complex neurological conditions, mental health, folks living in long-term care that need a little extra support to manage with their activities of daily living and help mitigate responsive behaviours.
So BSO is Behaviour Supports of Ontario. Basically, we support referrals that the long-term care homes send into us when they're having difficulties with responsive behaviours with their residents. And then we also support new admissions with the transition into the home as well.
Our job is to model and mentor and coach the staff in long-term care homes. We come up with different out-of-the-box ideas, different approaches. We may be even bringing in a consultant from the community. Whatever we can do to wrap those services around the resident and make that best outcome.
We compared our current practices with RNAO's best practices to identify the gaps and areas for further improvement. So we started with person and family-centered care. Our motto is, I am who I am, so help me continue to be me. So next we went with pain management, because with people living with dementia, they cannot always express when they feel pain, so sometimes pain goes undiagnosed, unrecognized, or untreated. The final one that we chose was the triple D, delirium, dementia, and depression. And again, with depression and delirium, sometimes the symptoms can be confused with those of dementia. So staff really championed change. We formed working groups for each of those guidelines. With BSO, it was so easy because there's such a passionate group of people. They truly care about making a positive difference in our residents' lives.
So when I started to work with Behavioural Supports Ontario, I recognized that they were really leaders in caring for the residents of long-term care. And I thought that they would be an excellent candidate to become a best practice spotlight organization. To be a best practice spotlight organization means that you implement several best practice guidelines thoroughly, you sustain those, you share the information and knowledge that you've learned with other BPSOs internationally. And this moves the work forward of everyone who works in healthcare. Groundbreaking, but Behavioural Supports Ontario for H&HB is the first organization of its kind internationally to be a BPSO. This is a unique, groundbreaking organization. They are using evidence-based best practice in every aspect of care delivery.
Person-centered care is looking at them as a whole person, emotionally, physically, spiritually, and making sure that all of their needs are met. And family-centered care is about including the family, including the resident, on what we're doing and what we're trialing. So we will gather information from the family, complete different tools, assessments along the way.
BSO is an integral part of our team. BSO brings forth education, expertise, tools, and connections. So without them, we would not be providing the quality of care that we are now.
When you're putting your parent in long-term care, you don't realize the transition and how hard it is. That's where BSO fills the gap in between and creates a communication, gets outside resources that we don't even know sometimes are available to us. BSO really helps with that transition and going forward.
When we get that referral for transitional support, I complete a tool that's called an I Am Who I Am. And that really gives us a clear picture of that resident. And then we take that tool, share that with the staff in the home to really promote who that person is with their interests, their hobbies, their food likes, dislikes, and the routine of their day. And then we advocate that for them.
When you've never been into a nursing home before, it's quite strange to get used to.
And scary.
And scary. Your whole life changes. It's very demoralizing, really. We couldn't get together when we first came in. Of course, the bug, the COVID. So Amy and Crystal, you know, were very kind and did everything they can to get us together. They come and visit and talk, which you need. You know, they preach like, think positively.
Over the years, the staffing levels in long-term care haven't changed, but the behaviors have increased.
Where BSO is very helpful is that they're that additional support.
Every behavior has a meaning. It could possibly be pain. However, it could be a change in environment. They will display some of those responsive behaviors. It's so important to make sure that we figure out what that trigger is so we can provide the utmost best quality of life for that resident. So at that time, myself as a clinical coach would complete a pain assessment, putting those observations in and then advocating for that resident to the long-term care home.
As a personal caregiver, I feel that BSO creates an environment for our residents that makes them feel more individual by providing caregivers and family all the resources and help to do our job as impactful as possible.
We're kind of the voice for the staff, not only the resident, because they're seeing things that are missing. It's like a missing puzzle. We get to put that puzzle together.
It's not just one voice anymore, it's a whole team effort. This is a team that listens and that effectively works with everybody in the building and makes an effort to make sure that everybody's opinion gets heard.
The science and the evidence are working because we're seeing the successes. We're seeing improvement in quality of life with the residents. We're seeing the relationships between staff and resident improve. People think that their life ends when they come in here, but they have so much more life in here, and they have such good stories and their history that they love to share, and they love to talk about it. They just need someone to listen. And I love being that person for them and building those relationships.
I want us to do better. I want us to get stronger, and I want to make sure long-term care homes are supported the best they can, so our residents are always the center of that universe and their family are part of that team.